Now, I would like to warn you that some of those photographs are really graphic, because I'll be showing you some of the wounds, and I know that some of us like really, don't want to see our pet in such a condition, but sometimes it happens, and so I would like to show you, what kind of healing we can do. So if you don't want to watch it for the next 5 minutes, you may look away, for example. Okay. So this is a case when a dog was attacked. So this is a homeless dog that was attacked, and upper left photograph, this is when the dog was brought to the clinic. Now this is the case study. It was done by students at the veterinary clinic of the University of Santo Tomas in Chile, and Georg, our representative in Chile, he sent us this case study, and when he worked with several students at the university, and they worked with cats, with dogs, with horses, some really amazing cases from Chile. So in case of Milagros, that's the name of the dog, this is what they had to deal with. It's a huge wound, really big wound, and luckily for the Milagros, the clinic had dealt a device, and they began the treatment right away. Meaning, after they cleaned the wound, you can see the day 1, they started to apply coMra therapy. So what they did is really simple. Again, nothing is difficult. Just do the scanning. You can see about 5 minutes per 10 square centimeters at 1000 hertz. That's all we did. And for 10 days in the clinic, they applied coMra therapy. During the first 3 days, it was several times per day, then it was 1 time per day. But basically, the first photographs showing you how the wounds start to actually close. And day 10, this is when Milagros was, they found a new owner for the dog, they taken it to a new home. And the veterinary doctors, the students, everybody was so amazed and really excited, how wound was closing. Because it's such a large wound, the problem is that it wouldn't be healing. There would be huge scabs forming, and then later on you will see enormous scars. So when the Milagros came for a follow-up visit, you can see day 43 and then 146 days. The wound is closing really nice. There was no scar whatsoever, and the amazing part is that the fur, the hair follicles somehow were actually preserved, and the wound completely eventually healed without even a trace of this huge wound. So what you can see here is that, even without extensive surgery, and in this case no surgery was done, no stitches were applied, we can really accelerate healing, and it's a high quality healing. That's what we want to see. Now the second case of the also large wound on a dog's back, again very similar situation. Now this is from the Altai University. So here the difference is that when the dog was attacked, it also had wounds on the back. Now, but for 2 weeks, there were no treatment, no coMra applied, and in the black here, you can see this black color. This is the scab is forming. Now, this is not a very optimal type of healing, regeneration, and typically what happens is that scab eventually becomes a scar tissue, and like here, for example, there will be no fur regrowing. It will be basically a huge scar area. Now they began applying coMra therapy. It was a 9-day course at the clinic. So here they did also universal 3. Again, this is the protocol to support overall metabolism in the body, the blood. Plus they did the scanning for 10 minutes over the injured area. So what you can see by day 9, the scab has naturally by itself fell off. You can see very nice granulation tissue building up here. You see this pinkish area. The second wound is also closing up really nicely. And then when the dog came for a follow-up, this is about 3 months later after the injury, it was a complete recovery, meaning you see the nice fur. There is no scar tissue, there is no bald area, just very nice skin and fur. So the dog is full of energy, jumping up and down. Yeah, that's what we want to see with dogs, with cats. Really nice healing.